vision has always been to be this like one-stop shop that people can come to and get consistent education and support without feeling judged. They're going to feel heard. And so it starts in pregnancy. It actually starts before that. We do preconception teaching and support, as well as prenatal education. We do a ton of feeding support, both breast, bottle, formula, then a ton of sleep work. We work with a lot of fussy babies. And I think our sleep programming is different because we're looking at it through the lens of a nurse, and it's assessment based. And I would argue that often our sleep issues are underlying feeding issues. So we look at it all.
Welcome back to another episode of Beyond the Birth Story podcast. If you are joining for the first time today, I'm your host, Alexis C. Girl mom, angel mama to one of the sweetest boys in heaven, birth trauma and uterine rupture survivor, and former NICU mama. Here you will have the opportunity to ask and have your burning questions answered by professionals, feel connected to other women's experiences as we normalize the different aspects of this journey we are on as moms. The real and raw moments of healing are shared here as we navigate loss, embrace strength, and find hope again while learning to live after loss. Please note the topics discussed on this podcast are for educational purposes only. Please see your personalized medical professional if you have any questions or concerns that arise from listening, including diagnosis and treatment. Well, welcome, Carrie, to the Beyond the Birth Story podcast. I'm so excited to chat with you today. One of my girlfriends actually sent me your profile when I was having some feeding issues with my youngest. And so I've been following you for quite a while now, and you are just full of all of the best knowledge. So I'm so excited to share you with my mom friends, all my future mom friends, and be able to ask you some of my burning questions I have.
Sure. Well, first of all, thanks for having me. And then thank you for following. I appreciate it.
It's amazing what you're doing. So I'm just going to dive right in. And can you kind of tell us a little bit about what the Mama Coach is and how you kind of came up with the whole thing?
Sure. So I'm Carrie. I'm a registered nurse and a lactation consultant and a Menopause Society certified practitioner. And I started the Mama Coach. It'll be 10 years this year. And I had worked in labor and delivery and postpartum. I've been a nurse for 20 years. So it had been 10 years at that point, and I loved it. A huge reason why I do what I do is because I care so deeply for women and for families. And that relationship that I got to have with my patients, it was so special to me. And the challenge I was having is that I had my own kids, and all of a sudden my heart felt really pulled in two places where when I was at work, I missed my babies, and when I was at home, I missed my work. And I worked full time. And I also was struggling with the fact that healthcare is really strained, and the relationship that I wanted to have with my patients wasn't always available to me just because of time constraints and staffing constraints. Like, huge shout out to any nurse who's working right now, because the load is heavy. And so that's why I started the Mama Coach, because I'm like, you know what, there has to be a better way. And I did it on my own, and I wrote the programs and figured out how to market. And that was 10 years ago. And it grew really quickly. And I think it's a term that I use called listening-centered care. That's the kind of healthcare that me and my team strive to give, because I think that's something that's missing when, a parent has a problem or a woman has a problem. Often, and obviously I'm generalizing, this doesn't happen all the time, but sometimes we make a judgment without actually listening. And I believe that the answer lies in somebody's story. So now we're a team, almost 200 nurses globally. Use the Mama Coach brand and my programming and my mentorship. And that's our goal, is just to give really fantastic care, education, and support.
And then you don't just focus on feeding, right? You do kind of the sleep, you do
We do.
Everything a little bit, hey?
My vision has always been to be this like one-stop shop that people can come to and get consistent education and support without feeling judged. They're going to feel heard. And so it starts in pregnancy. Well, it actually starts before that. We do preconception um, teaching and support, as well as prenatal education. We do a ton of feeding support, both breast, bottle, formula, then a ton of sleep work. We work with a lot of fussy babies. And I think our sleep programming is different because we're looking at it through the lens of a nurse, and it's assessment based. And I would argue that often our sleep issues are underlying feeding issues. So we look at it all.
Yep.
And then we do starting solids and CPR and choking. And then we do a lot of potty training as well.
Okay.
Mhm.
That's amazing. Yeah, I have a ton of questions, mostly feeding based.
Okay.
Um, as that's kind of why I started my following and where you've given me so much advice just kind of virtually up to now. And so they're in no particular order, but what would you say are like your biggest feeding issues that you see in your patients?
I would say the biggest Well, it's tricky because there's many, and
Mhm.
feeding issues it can be one thing and it presents this way for this person and it presents this way for the next person. But something that's interesting is that I think when somebody has a baby and they're trying to feed their baby, however they're trying to feed their baby, there's so much worry about, am I doing it right? Is my baby getting enough? That is a huge question that floods my DMs all day long. And so a lot of what I do is actually reassurance that, you know what, you're doing it. This is right. Lean into what's working for you. You and your baby are thriving.
Mhm.
So I think a lot of what I do is listening and then providing reassurance. But then I would say there are supply issues. So I see a lot of oversupply, which isn't talked about a lot. A lot of people follow me because they have a fussy baby, and
Mhm.
often they're given the quote unquote diagnosis of colic, and colic is not a diagnosis; it's actually a symptom. And so I would say that's a common thing that I see is exploring, why is that baby so fussy?
Mhm.
And it's either oversupply, sometimes it's undersupply, or it's a milk transfer issue. So sometimes that means it's a latch issue, and sometimes that means that there's an oral restriction with the baby or some body tension or both.
I feel like that's why we get so kind of distraught sometimes, especially learning to feed for that first time, is everything that you just described. There's so much that we have to look at and essentially worry about sometimes if we don't just have that, calm, happy baby that just eats and sleeps and poops repeats, right?
Mhm. Yeah.
It's funny that you brought up the colic thing because that was actually one of my questions too, was the signs and symptoms of colic.
Mhm.
But if that is kind of a symptom, can you just elaborate on that a little bit?
Sure. And I hope somebody listening to this has well, not that I wish a fussy baby on anyone, I don't. But I feel like it is so disheartening as a mom and anxiety provoking to be told that your baby is fussy. Don't worry, it's colic and they will outgrow it. Because in that moment, there is so much stress. There's stress for the parents, there's stress for the baby, there's guilt. It is so complex. And I don't think it's fair to tell somebody their baby has colic and don't worry, they'll outgrow it if they have not had a feeding assessment. Because in my experience, I would say that often a fussy newborn, so under that 12-week mark, there's something feeding related going on.
Mhm.
And so colic is described as, I think it's 3 hours of crying um, for 3 weeks, 3 hours of crying every day for 3 weeks consecutively or something. And that doesn't have to be straight. Can you imagine?
No.
And I do believe that there are different temperaments in babies. Some babies do cry more and some babies do cry less. But why wouldn't we get a full feeding assessment
Mhm.
done so that we can figure it out together? Because I, you know, every time I've worked with a family, we figured out something that we can do to improve it. And how good does that feel to a new parent to learn how to soothe their baby and to feel like they're helping? Because it's a really helpless feeling as a parent to just have to be told, oh, don't worry about it.
Mm-hmm.
Of course, you're going to worry about it.
Yeah. And no mom's going to sit there and let their baby just cry. I'm like,
No,
I've never experienced colic, but even in the teething days and things like that, when there was like unconsolable, and I was the one sitting there crying with the baby, like it's so stressful.
it really is. And it's one of the big reasons why I have two boys of my own. And my oldest boy, this age is me, but he'll be 17 right away. And
Wow.
I, I remember vividly, like I had this confidence because I was a nurse. I had this confidence that like, oh, I can do this. And then he was really fussy and like, I just felt so overwhelmed and so scared that I was failing him
Mm-hmm.
and nobody could help me. I went to provider after provider after provider and it took me figuring it out that he had allergies, cow's milk protein allergy. And
Mm.
it took a long time, and there was a lot of anxiety, a lot of guilt. I think it actually changed how I parented because I was so scared that
Yeah.
something was wrong with him.
Yeah, I feel like it can go both ways too, especially with the cow's milk allergy and things like that. I had taken my son, he's 7 months, 4 months corrected right now, and to the osteopath because he was having um what I believed was severe reflux, which we'll get to after seeing your reflux post.
Yeah.
Um but it was just continuous spit up and aggressive amounts. And when I went, it was immediately, she was like, oh, are you breastfeeding? I'm like, yeah. She goes, we should probably switch to formula. I'm like, why? And
Whoa.
she was like, he's allergic to your milk. I'm like, I don't think that's the problem. Like, I myself don't eat dairy or anything like that, but I'm like, wouldn't I have more issues like figuring out which formula would be best and things like that? I'm like, I've never had someone jump to a different alternative that quickly, especially when it starts out as breast milk. I feel like maybe we're a little bit quicker to jump if our baby's already formula fed. But yeah, I was just that took me back. I was
And
like,
I, I, I'm sorry that happened to you because I don't think it's my job or a healthcare provider's job to say, this is what you need to feed your baby this way.
mm-hmm,
Yeah, and when it comes to cow's milk protein allergies, you can breastfeed and have a baby who has a cow's milk protein allergy.
mm-hmm,
And also, spitting up is potentially one sign of a cow's milk protein allergy, but it's also a sign of many other things, and also babies spit up. So you need to do a full assessment before anybody is making any kind of huge judgment calls like that. There should be a huge history taken. I would want to hear your whole story,
mm-hmm.
and I would really want to watch a feed and look in your baby's mouth and do a full assessment.
I love that you even started out talking about, you said something along the lines of however you're feeding your baby. And I appreciate that outlook so much. I feel like nowadays, and not always in the hospital, but a lot of nurses, if you don't want to breastfeed, there's a bit of judgment passed on that. And some women just don't feel comfortable doing it or it's not in their wishes. And just to make everybody feel comfortable that no matter how you're feeding your baby, like a fed baby is best. And so to find a provider that also has that outlook, I think is extremely important in these moms' journeys.
It is, and I think back. So I wrote a article for Today's Parent like long time ago. I think it was 2017. I still get emails, probably a few a month, sometimes from angry providers who think I'm horrible, and sometimes from gracious parents who found the message and needed to hear it. And the story goes, it was a mom that I had worked with, or actually her partner called me and said, can you come and see my wife and our baby? And her baby was a few months old, and she had been trying and trying and trying to get to the root of all their feeding challenges. And so I showed up, and I got to the door, and this mom was a shell, a shell of herself. And I just looked at her and thought, oh my goodness, like I could just, my spider senses were going off. Her partner was almost holding her up. And we sat down on the couch, and I just said, tell me your story. Like, let's start from the beginning. And honestly, this woman had been, oh my goodness, she tried everything to feed this baby, and they were struggling, both of them. Like,
Mm-hmm.
he was fussy and mom was not doing great. And I just said, you know what? It's okay if you want to give your baby a bottle. If you want to switch, that's okay too. And she broke down in that moment, and I realized that she hired me for permission. And I thought, I made that judgment call in that moment because I will walk to the end of the earth with somebody who wants to breastfeed, and that's where their best interests lie, and they've decided that. But I wasn't about to tell this mom that we were going to jump through 36 more hoops when I could see that her mental health was in huge distress. And she broke down in that moment. And I still get a card from her and on her baby's birthday, because that was the day that her relationship changed with her baby, because she was just so frantic about feeding and her anxiety was so high. She was struggling to bond with her baby.
Mm-hmm.
And I just thought that's what she needed. And I just think that feeding is so personal. And you might even want to breastfeed, and maybe it how you feel about it changes, and that's okay. Or maybe you really, really, really want to, and that's also okay. There isn't it. We have to think about maternal mental health, because I believe you need healthy parents to have a healthy baby. And anyways, that I digress a little bit, but I really want parents to lean in to their own intuition. I believe that they know their baby best and they know their family best. And it's not my job to tell somebody how they should feed their baby or how they should sleep. It's my job to walk beside somebody to help them meet their goal.
That was a perfect example. It gave me full body chills and my eyes watered. I'm like, we do put so much pressure on ourselves to feed our babies a certain way. And thankfully, like my wishes have always been to breastfeed my babies, and I have been able to successfully. But I've also been surrounded by friends of mine who that's their wish and their body just will not produce. And even one of my best friends, her youngest is a couple of years older than my youngest. And the first time she seen me breastfeed, she said, I want to cry. And she said, just seeing you do that brings back all of the thoughts that I had when I was not able to. And she fought so hard. And she's like, when you pump for 30 minutes and you get one drop in your pump, it's it totally affects the mental health. And I think sometimes I've come across with we are so focused on breastfeeding, we almost don't put that mom's mental health first. We're like, you just have to do it because
Yeah.
that's in quotations what's best.
And I think it comes down to early supportive support, if that makes sense,
Mm-hmm.
informed support, because your friend, I don't know her story, but I'll give you another example. Is I've worked with people who are trying to pump. They're trying to build their supply. They get nothing. They're told by somebody like, "Oh, you don't have enough." And then I go and we fit the pump properly, and we all of a sudden things change. And so, yes, there are a percentage of women who can't produce milk. It's a small percentage, but there's also a ton of misinformation out there. And I think early intervention and support changes things for families. And I like what you said about like choosing. Like, I think families should have a right to choose, but I also acknowledge that it doesn't always feel like a choice. You know, I think that some families, women, I say women, but I mean parents, but um they want to breastfeed, but for whatever reason, there's just challenges in the way. So I think sometimes the word choice even sucks, for lack of a better word, because it doesn't always feel like it.
Yeah. And like some people just don't have that choice if,
Mhm.
and two, and you said a small percentage of women cannot produce, and that makes it even heavier on the ones that fall into that small percentage because not everybody can relate.
And I think sometimes even they fall into that small percentage, or they were given, misinformed advice out of the beginning. And that impacted how they produce milk.
Hmm.
And
And even with, I remember this was 5 years ago with my eldest, but I bought a pump and I was younger at the time. And so I wasn't really educated in the pump world. I didn't really know that there was different size flanges. I didn't think that mattered. And so to have a space to go to be educated in that, and obviously I think it's come a long way in the last 5 years. But just to know that, yeah, what is size appropriate? What should feel comfortable? I was in so much pain when I was feeding her in the hospital, and I was petrified to ever start breastfeeding again because I'm like, I like it hurt so bad. And so to get past that point, and then so many women I've talked to, they're like, no, we had no pain at all. And
mhm,
so it's differentiating too what is normal, and I use that word very lightly, versus abnormal in starting that feeding journey.
like red flags. And
Yeah.
um, the number one indicator of breastfeeding success is prenatal breastfeeding education. The more you know, I think that's about most things, really. The more informed you are about something that you are going to start doing, the quote unquote easier it is.
Mm-hmm.
And I think I see that in my practice, because I think somebody's birth story is obviously like so fundamentally important, and having a birth plan is so important. And I respect that. And I also wish for these people to learn about feeding, because I can tell you, if you know, for example, how to antenatal hand express, which is collecting colostrum while you're still pregnant at the end, if you know that skill, and then all of a sudden you've gone through the roller coaster of birth and your baby won't latch, or her blood sugar's low, or you get separated, all of a sudden you have colostrum with you, and you also know how to hand express. Because I can tell you from my years of working in the hospital, trying to teach somebody to hand express after they have a baby is hard. It's hard to learn anything.
Yes.
If you know that, just that one skill, for example, it sets you up for long-term milk supply. And so I encourage anyone who's listening to this to take a prenatal breastfeeding workshop, have a conversation with somebody about what are the things you need to know, and just tuck them in the back of your brain, and it will make it easier.
The hand expressions actually was on my list too, because from a personal experience, I didn't even know where to start with that. My nurse was like, "Okay, you're going to hand express." I'm like, "Mhm.
What?
Oh, okay." Like, as I just like squeeze my boob. She's like, "What are you
It's
doing?"
it's I don't know if this podcast is video
It
and
is. Yep.
okay. And so it's counterintuitive, because when you say hand express, I kind of think about milking a cow, which
That's
sounds
what I
silly,
was doing
but
to myself.
a lot of women, and I get it, want to do this. So they pull out on their breast, they like
Yep.
milk it. And it's actually counterintuitive. So what you're going to do is put your fingers back from your areola, and then you push towards your ribs. Go back towards your rib cage, like your chest wall, and then bring your fingers together. So it's not out,
Yeah.
it's in. And that's a hard thing to wrap your head around after you've just had a baby.
Yeah.
But if you there's research that shows if you stimulate your breast at the end of pregnancy, and obviously you need to check with your care provider, because if you have a low-lying placenta or a placenta previa or something, that is a contraindication. But usually it's safe to start around like 37 weeks. And if you do it for 5 minutes each breast twice a day, you will get more comfortable with your breast, which is a huge skill, because if you haven't fed before, or if you fed before and it didn't go great, this level of comfort is so awesome. And then the second thing is you have a stash of colostrum that you can bring with you to the hospital and give it to your baby if you don't have a great feed. And then third is it can impact your long-term milk supply, meaning your prolactin levels at 6 weeks are higher than if you didn't do it. So I think it's a really awesome skill to have.
Yeah. Yeah, I definitely did the milking a cow thing, and I think my
Totally,
Elsie looked at me like I was a
you
little
and
loony.
me
She's like,
and every other
"You
person.
don't know what I'm talking about?" I'm like, no, because in my head it makes sense. I want to pull the milk out, not push it
I
into my body to
know.
come out, you know?
It's super counterintuitive.
Yes. So you would recommend doing that like while you're still in the hospital to kind of get your milk supply in? What about mechanically pumping? I've heard very different things about that. Should you attach a pump right away? Should you hand express, or just leave it up to essentially your baby to latch?
Okay. So I would hand express in pregnancy at the end with permission.
Yep.
After you got the okay. And then if when you have your baby, I I would attempt to breastfeed, but I also recognize that that doesn't always, we imagine it like the baby just crawls to the breast and everybody feeds and it's beautiful. And I hope that for everybody. But I also know that sometimes it changes. Sometimes the baby has been through birth is a big deal for that baby. And
Mhm.
they're not always ready to feed right away. And so if baby won't feed or can't feed, maybe you're separated, then it's a beautiful thing to start hand expressing. I would hand express first. And if you want to pump, sure. But you don't need to feed your baby and hand express and pump. You don't need extra jobs if that baby is feeding at the breast. It's only if the baby won't feed. Then instead of skipping that stimulation, because that stimulation is important for setting up long-term milk supply, for
Mhm.
helping your milk come in. And I feel horrible for families who have had a rough start in the beginning, because it can end up impacting their breastfeeding journey in terms of supplementation, and then they have low supply. So if you get separated from your baby or your baby won't feed, and express both sides. You can add a pumping session if you need to. The most important skill is hand expression.
Which is a very good point. And yeah, if you're listening to this, start educating on that
Yeah, yeah.
expression. Do you notice, and this might be more so when you were working L&D, or if you're seeing women really fresh postpartum, do you notice quite a big difference in the initial milk supply coming in with a C-section versus a vaginal delivery?
So there is some research that tells us that lactogenesis, which is your milk coming in, can be delayed in a woman who has had a cesarean section. It also can be delayed if you're a first-time mom. It
Hmm.
can be delayed if you've had a traumatic birth. So there's lots of reasons why. And that's where feeding your baby frequently is one of the best things you can do to help bring your milk in. Another tip is night 2 postpartum. I see a lot of families get sent home after 24 hours after having their baby. And it's really normal, typical infant behavior for your baby to be very unsettled on night 2. And a lot of families get really panicky about this, and I get it, where they're like, all of a sudden, this brand new voice in your head of like, oh my gosh, are they getting enough? Do I have enough milk? They must still be hungry. And so we start thinking, I better supplement. I give them formula, or they give them a pacifier. And the beautiful, incredible thing, I think, about this dyad relationship of this baby is wired to bring in your milk.
Mm-hmm.
And so they are unsettled on night 2 because they want to feed frequently. And it's not because they're hungry. It's because they know it's their job. Because the more they stimulate your breasts, the quicker your milk will come in. And so on night 2, I'm asking, is your baby have wet and dirty diapers? Yes? Okay. Well, then let them just be at the breast. Let them be unsettled. I wouldn't give a pacifier then. I think pacifiers are a beautiful tool, but once your milk has come in and breastfeeding is established and your baby's back to birth weight. So if that can provide some reassurance to somebody who's listening to this, who's about to have a baby, I don't think we talk about that enough.
Mm-hmm. Do you see cluster feeding quite often, or is there a certain kind of age or a certain maybe milestone, such as growth spurts and things that a baby's going through, that they might do that more often?
I think cluster feeding is a very typical newborn behavior. And
Mm-hmm.
where we get confused is that the internet tells us, and postpartum tells us, and pediatricians tell us that babies feed every 3 hours. And I'm here to say babies don't tell time. That's not how it works. It is very typical for a newborn to feed and then want to feed again in an hour, and then want to feed again in an hour and a half, and then sleep 4 hours, and then want to feed in 2 hours. That is normal infant behavior. And there are times, especially in those evening hours, where it's very common for a baby to want to frequently feed. And so I think if we can throw out the idea of a schedule and instead get really in tune with our babies,
Mm-hmm.
then all of a sudden we're not as stressed or anxious when our baby wants to feed every hour, because then that voice that I'm talking about starts going, do I have enough? Is my baby okay? When really it's typical normal behavior, newborn behavior.
I wanted to ask you too, because I know, again, personal experience as a first time mom. I feel like when my milk first came in, I had like boulders on my chest. And then a few days later, they just went soft. Baby was fussy. And I was like, oh my God, did my milk like totally go away? And so I was always, as a first time mom, exclusively breastfeeding my newborn, always wondering if they were getting enough. I was panicking about the volumes. Is that something we need to do, or again come back to that intuitive?
I think you and your baby will tell you everything you need to know, right? More
Mm-hmm.
than the internet, more than me. And so what I mean by that is, how you know if your baby is getting enough is ask yourself, do they have wet and dirty diapers? Yes? Awesome. Are they maintaining their curve? Weight gain, right?
Yep.
So I'm not asking you to weigh your baby every day. I'm just saying, when you go for a checkup and it's been 6 weeks, are they maintaining their curve? And what is their behavior at the breast, or the breast in this instance? A mom who is struggling with supply will have a baby consistently crying and pulling at the breast. Babies do that sometimes, once in a while. That they do it for all kinds of reasons. But if they're consistently doing it, and they're doing it in between feeds, then I'm wondering, do I have an issue?
I want to talk a little bit about the reflex,
Mm.
and when when should a mom really start to worry about that? And what
You
are
know,
kind of the signs and symptoms? I think we get it mixed up often.
and you know what? It's so fair that moms get mixed up about it, because it's kind of like that word colic.
Mm-hmm.
Reflux is used as a diagnosis all the time in infants, right? It's reflux. But here's the thing. There's something that's called gastroesophageal reflux disease. That's called GERD. GERD is a very sick baby. It happens in like 1% of the population. These babies are being impacted by their reflux, meaning these babies are sick. They're really fussy and they really struggle to gain weight, and it's not very common. What is common is GER, gastroesophageal reflux. All babies have that because they have an immature sphincter, meaning sometimes the milk shoots back up.
Mm-hmm.
And most babies, that resolves by like 8 to 12 months in almost all babies. What is the challenge is that when babies have symptoms, like I'm not talking about the baby who's spitting up sometimes, but they sleep well, they feed well, they're not fussy, and there's no concern. Those babies are just babies that have GER that will outgrow it. It's part of the process of being a baby. But where the challenge lies is if a mom has a fussy baby who's spitting up. She's had all kinds of feeding challenges. Maybe she's working at her supply. Maybe she's supplementing with formula. Maybe she's formula feeding. Maybe her baby is also rashy. Maybe her baby's gaining a ton of weight. Usually, when it is spit up plus another symptom, I would say you need a feeding assessment because there is something going on here.
Mm-hmm.
But the challenge is often that gets diagnosed, and I'm generalizing, as reflux, and it's not. In my opinion, without seeing anybody's baby, I would say you need a feeding assessment because you know what that could be? It could be a milk transfer issue, so latch. It could be an oral restriction. It could be a timing issue. It could be undersupply, oversupply. It could be an allergy. And we need to, in order to get to the bottom of it, I need to hear your story from the beginning. I need to watch it feed and I need to look in your baby's mouth. And so if somebody isn't doing all of those things and they're saying your baby has colic or your baby has reflux, I would encourage you to get another opinion. Get a feeding assessment. We do them all over the world, and you can find either us or somebody in your community, but that's what a feeding assessment is somebody not just coming in 5 minutes and telling you what this is. It is tell me your story and start from the beginning, watching an entire feed and looking in your baby's mouth.
I love that. Yeah. Do you check, like, do you ever look for like tongue ties, lip ties? Is that within your scope as well, or?
It's not in my scope to diagnose something,
Yep.
but what my job is to advocate and empower parents to be able to make informed choices. And it's also my job to help connect people with providers who have experience in breastfeeding medicine, right? Because where we struggle as a society, I think, is opinion-based medicine. There's lots of things that parents ask me, and I say, I don't know, because I feel like that's my responsibility as a healthcare professional, is if you don't know something, say it. And that's okay. You're doing that family a huge favor. I either say, I don't know, but I'm going to help you find the answer, or I don't know, but I'm going to help you find somebody who does. And where we get hung up in all kinds of medicine, whether it's breastfeeding challenges or back pain or whatever, is giving an opinion as a healthcare professional without knowing, because that causes all kinds of confusion for patients. And so I don't even know where I was going with that, but oral assessment. So what
Yes.
my job is, I'll tell you what I see, and then I will give you resources to help you decide, there's potentially a problem here. It's not my job to tell you this is 100% a tongue tie or a lip tie, but I can say it looks like this. Let's talk about function, and let me refer you to a care provider who I know knows.
Mm-hmm. Are there certain things that you would like recommend that a mom go and see for like a lip tie, tongue tie, like clicking when they're eating? When would you recommend that somebody do that?
So it isn't about how a baby's mouth looks. That's not the only thing. Because often parents get told, oh, they can stick their tongue out like it's not a tongue tie. It's about how a tongue functions and how a mouth functions. And that's why watching a feed is so important. I would encourage somebody to get a feeding assessment done if they're having pain when feeding, or maybe they had pain initially and then it went away, but they're having more issues now. I see that. If they're having a baby who's struggling to gain weight, or in some instances, gaining a ton because they want to feed all the time. If
Yes.
they're falling asleep at feeds, if they're starting to refuse to feed or refuse the bottle, you see that too. They won't hold a pacifier in their mouth. They're really fussy. And not one of the symptoms that I just rattled off, babies won't necessarily have all of them, but very rarely do they only have one. For example, if your baby is happy, healthy, growing, but will not take a pacifier, would I say they have an oral restriction? Probably not, but if, for example, breastfeeding hurt, you're having supply issues, you're now supplementing, they won't take a bottle easy, they won't take the pacifier, I'm starting to wonder,
Mm-hmm.
let's look at that. But it's also not as simple as just clipping the tongue tie or revising the lip tie. It is a multifaceted approach where I'm working and my team's working with someone about latch, and because that baby has to now learn how to use that new tongue, right? And the other thing is that their little bodies have compensated for that
Yes.
restriction, even in utero. And so I bring in allied health care providers like physiotherapists, occupational therapists, cranial sacral therapists, like anybody who says, oh, yeah, we'll just clip it and you're off to the races. That's a red flag because it is a multifaceted approach to getting that family feeding well. Sometimes we clip it and they are off to the races. I will say that it does happen. But if that isn't you, please know that it's a normal thing for it to be a process to become a better feeding journey for you.
And there's so many resources in place too. And it's nice to have like someone like you alongside these moms willing to help them find those resources. Because I think a lot of times it's up to us to find our resources and to know who to ask the questions to and things like that too, right?
Who to ask, and then based on somebody's response, I always want parents to know that it's okay to ask for a second opinion on anything,
Mm-hmm.
right? Like as our babies grow, your gut, your intuition, you do know that baby best. And it's always okay if something's not sitting right with you, whether it's my advice or anybody else's, you deserve to be heard as a parent. If someone is brushing you off and like deciding in 5 minutes what's going on and you have more to say, right? Or somebody makes a judgment call and it doesn't sit right, it's okay to ask somebody else and you should. But I also recognize it's not easy to always know who to ask.
Yeah, there's so many different providers out there. And like you said, like there's PT, OT, LCs, there's your regular GPs, like,
There's so many amazing providers out there,
yeah.
family doctors, pediatricians. But you know what I think is so cool is that when we can all come together and work with the best interests of the baby and the mom, the dyad in mind, that is when we have the best results.
I totally agree. Speaking about pacifiers, how would you recommend like finding the right one? We in our house use the Ninny Co
Mhm.
pacifier after we had our son's tongue and lip tie released.
Yes.
And honestly, it made me a little nervous at first because Obviously, it's not your traditional pacifier.
No.
And for a lot of people, including myself, you don't necessarily want to spend that much on a single pacifier, right? And so,
So
yeah.
it this is a good question. And so it really depends on your baby and your feeding journey. So there's many, if feeding is going along fine, then probably any pacifier.
Hmm.
Really. Like this is the one I start with all the time. This is just the basic Advent pacifier.
Yeah, I think that's one we had in the NICU. One of
Yeah.
one of the many.
Yeah. I like it because you can teach your baby with your finger in there.
Yeah.
However, if you are having feeding issues, it can be tricky to introduce this. And this is where I see. So let's say you're having latch issues or supply issues. These kind of pacifiers, or like a typical pacifier, these babies have more of a shallow latch. And so babies don't understand sometimes when, like, okay, you're going to suck like this over here, and then you're going to have a big, deep latch at the breast.
Yes.
I shouldn't say babies don't understand, because sometimes it's not a big deal if you've never had a feeding issue. But if we're trying to teach a baby to open their mouth wide, but we're saying over here, don't worry about it, it's
They'll
going
get
to cause.
confused.
Yeah. And so
Understandably.
here, I like this because it has shoulders. See how it has like baby will latch deeper,
Hmm.
and it's good practice. It actually helps them learn to have that big deep latch. It's a tool. Not only babies, newborns have an innate need to suck, but it's practice for a baby that's working on breastfeeding.
Yeah, it was so confusing to me when I initially pulled that out because with my daughter, she just took a soother and I thought every baby just takes a soother. They
Yeah.
just love them. But they're so dense, right? Because they're the full silicone or whatever material. And then when I pulled out the ninny, I initially laughed because of how much it represents a boob. And
Yeah.
then I was having to learn how to use it too because it's so like collapsible.
Really soft. Yeah.
Yeah. And I was like, but I was inserting it into his mouth as if it was a regular silicone
Yeah.
pacifier. So getting used to that. But I found it helped so much after he had his specifically tongue released to really
Yeah.
watch that motion.
It's a good tool.
Yeah, I really liked it. And it was, yeah, recommended to us as well. It was just very different to get used to. If a mom finds themselves having to supplement with formula, sorry, for whatever reason, how do you recommend we go about kind of mixing that into our routine? Does that make sense?
Yeah. I love this question because the typical common way that people are told if they're having breastfeeding issues that require supplementation is try the breast for X amount of minutes and then give a bottle. I hear that every day. And I suggest they reverse it. And the reason why is how frustrating for a mom and how frustrating for a baby to latch to the breast, be hungry and annoyed, and mom's watching her baby get stressed and annoyed, and then she watches her baby get satisfied with the bottle.
Mm-hmm.
And the baby's also learning this is annoying, and this is where I'm getting satisfied. So I reverse it. I say, okay, this is what we're going to do. You're going to figure out how much you're giving your baby a formula. Give half of that through the bottle in the beginning before you even feed your baby, because humans are more patient when we're not hungry, and your baby's the same way. Take the edge off. And then, so we're not giving them a full bottle because then they're not going to be interested, a little
Mm-hmm.
bit. And then we're going to latch the baby, and we're not looking at the clock. We are latching the baby, and the baby will be more tolerant of this. And we're going to do a lot of breast compression. We're going to do dinner. We're going to offer dessert. If it takes 30 minutes, that's fantastic. Don't look at the clock. And then you finish the supplement. So it's like supplement, breast, supplement, leading to supplement, and then breast, leading to breast. In my opinion, that helps parents get off the supplement faster if that's their goal, and usually it is.
Mm-hmm.
So I think that that's a shift in thinking, but I can tell you in my practice it works.
Would you add in quite a bit of pumping with that too? Like, is
Mhm.
it kind of so obviously if we're having supply issues, specifically not enough milk, is it quite important to have that pumping component?
Yes.
And then on the other hand, if you have a fine supply and whatnot, is it super important that you add that pumping? Or if your baby is happy just exclusively breastfeeding, can
Not
you just do
every
that?
Yeah, not every person needs to pump.
Okay.
If you are exclusively breastfeeding and watching your baby and they're saying, I'm happy at the breast, I'm settled in between feeds, I have wet and dirty diapers, I'm maintaining my curve. No need.
Mm-hmm.
Unless you plan to give your baby a bottle sometimes. And then in that case, you could go ahead and pump. If you are supplementing, you need to pump because your baby is taking calories from the breast and it's taking calories from formula. And if you want to move to exclusive breastfeeding, we have to tell your body make more. And that is why I suggest giving a little bit of formula, keeping them at the breast longer because that's the ultimate stimulation. It's better than a pump.
Yeah.
And then giving formula at the end. And the reason why is it's called triple feeding, right? Where people try, give a bottle, and then they pump. Well, if you don't have a plan to get off of that plan, that is sustainable. That is going to cause all kinds of anxiety, exhaustion, and it ends up with a mom who's in distress. And it ends up often with a mom who ends up being like, you know what, I'm just going to give formula.
Mm-hmm.
And that's why working with a provider who can help you build a plan based on how much and then when are we going to move from formula, breast formula, um, and then because you have to pump at some point there. But if you have a plan so that you don't have to do it forever, that is when we have success. But if I'm telling somebody to triple feed forever, that is not a sustainable plan.
Mm-hmm. Is there a certain type of pump that you would recommend that you've had good success with, or?
There, honestly, different pumps are great for different reasons.
Mm-hmm.
And I'm careful to say that one is the best.
Yep.
What I can tell you is that often the flange that comes with them are too big.
Mm-hmm.
And so if you are having trouble, so if it hurts or if you feel like you're not getting milk, because I see that all the time, and then people start worrying that they don't have any, and then it is, if nothing's coming out, it is impacting your supply. So by making sure the flange fits, you will have so much more success pumping. And, any healthcare provider can help you. We book sessions all the time, helping people with flange fit.
Yeah, I really like that flange education because I don't think I know if I personally didn't realize that that could impact it so much.
I
Like,
hope that pumps get on board with offering different flange options maybe inside their initial, but like
mhm.
measuring is an important thing.
And it's measuring not your areola size, right? It's the size of the base of the nipple. Okay.
And the other thing is that your nipples get smaller after the initial postpartum period. So if you pumped a little bit postpartum, and then all of a sudden you're like pumping at 16 weeks, and you're like, I'm not getting anything. Like, what's going on? And then you start worrying, that voice in your head again,
Mhm.
I would remeasure because often you need a different flange size.
Very good piece of advice. I love that. So if moms out here want to find you and book a nurse, I see that you have that as an option. And globally, you said, which is amazing. How do they do that?
They can do it through our website. So the Mama Coach, so the MAMA coach.com, and then find a nurse. Or they can message me. I'm always kind of helping direct traffic.
Hmm.
We have a brand new membership that's launching where people will get direct access to me and my help. That's coming hopefully in the next 6 weeks. We're just working on it right now.
That's so
Um,
exciting.
yeah, it's going to be a lot of fun to. I just want a hub where people feel heard, and you can come and you can get the learning that you need. Let's drown out the noise and the millions of opinions. If I resonate with you, I'm hoping that I can help more,
I
because
love that.
I try my best on my Instagram comments, but I actually do my Instagram all by myself. So I often I drown in the comments. I try my best, but this will give people more access and get video responses from me.
Which I think is so important, right?
Yeah.
Um, will that be like virtual consults that you'll be able to do? Okay, so I was going to ask if you did that yet.
Yeah. And so it'll be it's exciting. It's coming. Stay tuned.
That's amazing. Well, thank you so much for taking the time. I know you're a busy, busy woman.
I appreciate you reaching out, and I appreciate
Yes.
you building a community for parents. I think that's so important.
Thank you. It was so nice to have a fellow Alberta girl on here,
Yeah,
and hopefully you keep getting recognized at your local Costco.
I know. If I had $1 for every time someone said, "You're not American," everyone knows I'm American. So it's a surprise when they see me out and about.
It's amazing. I'll put $1 in your jar because I was
Yeah.
definitely one of those women.
Well, thank you for having me.
Yes, of course.
Thanks for listening to this week's episode. Please take a moment and on whatever app you're listening to us on, press that follow button to stay up to date with all future episodes. If you or someone you know are interested in being a guest on the Beyond the Birth Story podcast or a sponsor, please visit our Instagram or Facebook at Beyond the Birth Story podcast and send a message or fill out that contact form. I would love to connect with you. As always, remember to be gentle, kind, and hold space for yourself when you need it.